Okay, so we'll finish up the bones here. This is the sternum. Its primary job is to protect the heart and, of course, hold the ribs. This is all the articular cartilage attached to the sternum. You have to know the three parts of the sternum. You have to know how the little indentation there articulates with the clavicle. We'll pull that out in a minute. So you have the top of the sword, the hilt. That's called the manubrium. This is the body called the gladiolus. And the little part here, which is actually a chunk of cartilage, is the xiphoid process. When you're doing chest compressions, you have to be careful not to push too hard or this can break off and it can lodge in an organ. The ribs, I don't get too excited about name those ribs. You have false ribs and floating ribs and true ribs. This is a rib. Think about this next time you eat ribs, because you're eating the meat that's around them. You're eating the intercostal muscles primarily. But there are 12 pairs of ribs. They articulate with the 12 thoracic vertebrae. The vertebrae, did I go over everything here? Then we need the clavicle. Clavicle is the collarbone. It's the most commonly broken bone in the body. You can see a flattened end here. This is the acromial process that articulates with the acromion of the sternum, of the scapula, and this rounded edge is the part that articulates with the sternum. So that's the sternal end of the clavicle, which you probably will be asked. It's the part of what we call the shoulder girdle. So you have the clavicle, and then you have the scapula. And the scapula in the back has a lot of parts. It has a little indentation here where the head of the humerus just hangs there, connected by various tendons and ligaments. It has a process that flattens across the top that articulates with the clavicle. This is called the acromial process or acromion process. The other process is the coracoid process, makes a C. It actually, coracoid means beak in Greek. And then you have this little depression called the glenoid fossa that helps form this whole glenoid cavity where the head of the humerus articulates. You have the spine of the scapula that we can feel along the back. Above it, up here, and you'll learn the muscle that embeds in there. This is the supraspinous fossa. Down below here is the infraspinous fossa, where the infraspinatus muscle is. Around, this would be the anterior surface of the scapula. This is called the subscapularis fossa. That's where the subscapularis muscle is embedded. And there's a notch here. You see that little notch? That is the scapular notch. That notch is there for nerves and blood vessels to run through. And that's it for the scapula. Now we'll look at the vertebrae. So you have 7 cervical vertebrae. You eat breakfast at 7. You eat lunch at noon. You have 12 thoracic vertebrae. And then you eat dinner at 5. You have 5 big lumbar vertebrae. You need to know the names of the top 2 vertebrae, the cervical 1 and cervical 2. This is called the atlas. It holds up the skull. And then cervical vertebrae number 2 is called the axis. See, they sit nicely together. The atlas allows you to move your head up and down to say yes. Your axis allows you to pivot the head and say no. You need to know this little protrusion here that helps keep these two moving in unison. This is called the dens, D-E-N-S. It has a fancy name process, but I think I just put dens on there. I want to make sure. I may have forgotten to put it on there, but you do need to know that. The opening through all of your vertebral bones is the vertebral foramen for your spinal cord. And most of the vertebrae, the atlas really doesn't have one, has a protrusion out here that you can feel along your back. And that little protrusion here is your spinous process. When we get to the bigger vertebrae, they have on the sides here a larger, what we call, spinous process. These are the transverse processes. Anytime you have a process, it's for attachment of muscles. It's also for some protection too. The body is this part here that I'm touching. Cartilage discs sit in these bodies. You can see that the cervical vertebrae really don't have much of any bodies. They do have some, and you're gonna have a little cartilage in there. There are also, we call facets, and those can create a lot of pain too, as they tend to deteriorate the articular cartilage in there, and then you've got bone on bone. So you have to be able to tell thoracic vertebrae from lumbar vertebrae from cervical. Well, cervical should look like an elephant's nose. You see that one's a little split like an elephant's trunk. And they kind of look like little elephants. Not as pronounced as the thoracic vertebrae. Definitely look like a giraffe with a long pointy nose, cute little ears and horns. Definitely look like a giraffe. That's the thoracic. And the lumbar, that are the biggest, should look like a moose. Big rounded nose, little jowls here. Of course, the little ears and antlers. But those are your lumbar vertebrae. They have to support a lot of weight. Most people will have problems with these later in life. Then you have your sacrum. Your sacrum was originally 5 bones that fused, and we want them to fuse because we want them to be very supportive. These form the posterior wall of your hip bones. There are holes in here, the sacral foramen, and they of course are for nerves and blood vessels to pass through. And then the coxibone. Coxibone was anywhere from 3 to 6 original bones that have fused. The average is 4. Some people are born with little tails, they just cut them off. They don't wag, shallow Hal, but that's your sacrum. Really hard bone to break, which is good. And we didn't want separate bones, or every time you sit down or move around, these would shift, creating a lot of pain. All right, so then in your list here, we have the humerus. The humerus is your upper arm bone that hangs in that glenoid cavity. It's rounded, forming a ball and socket joint. There's a rough raised area here called the deltoid tuberosity, where the deltoid muscle attaches. As we go down, there's a depression on the posterior surface and a depression on the anterior surface. On the anterior surface, this is called the coracoid fossa, coronoid fossa, losing it. That's the coronoid fossa. So if we take the ulna, we put the ulna here, you can see the little part of the ulna just hits into that coronoid fossa, that little depression, and around back, the ulna, this piece here, hooks into this depression called the olecranon fossa. So this is the olecranon process of the ulna, and this part here is the coronoid process of the ulna. Now this forms your elbow, and if you hit it just right, there's little nerve endings in that fossa that you hit, and that's what hurts. And thus they name this the funny bone, because you usually feel those nerve impulses all the way down the humerus. All right, there are 2 condyles at the base of the humerus. There's the medial one, and there is the lateral one. If we look at the ulna here, your ulna you should know in anatomical position is your medial bone. I can't hold them both here with any great degree of success. And your ulna in anatomical, or your radius in anatomical position is your lateral bone. It sits right here, so it can pivot. So the condyle here, where the radial is pivoting, is called the capitulum. And the condyle here that kind of looks, I think, looks like a spindle here, that is called the trochlea. Right? So those are your two condyles for your two lower arm bones. So we have the capitulum for the radius, so that's your lateral condyle, and then your medial condyle is your trochlea. And did I forget any other parts? I'm not too concerned about the epicondyles. We did the olecranon fossa, the coronoid fossa. Oh, the head and neck of the humerus. There's the head, there's the narrower neck. So that's it for the humerus. And then your radius and your ulna. Your radius, of course, on the superior end has this little rounded area so it can pivot. It has this little pronounced area here. You can see that. That's the trochlear notch. Fits into the trochlear part. What else? Radial tuberosity, not very prevalent on here. Well, this is more radial tuberosity right here. I don't think I'll ask that one. Styloid process. So the little pointy part here, that's a styloid process of the radius. The ulna also has a little one right here. That's a styloid process of the ulna. I would concentrate on the olecranon process, the coronoid process here, to fit into the fossas, and the little styloid processes here of the radius and ulna. Then we get to learn the bones of the hand. There are 8 carpal bones. There's a sentence that you should learn to help you remember them. You always start on the thumb side. You always start at what we call the distal row. And the sentence is, some lovers try positions that they cannot handle. So we're on the thumb side. There's a bone here, kind of lays on its side, called the scaphoid. That's the sum. Then lunate for lovers. Then tri for triquetrum. And then this little bone here that forms, the last one to form, is the pisiform bone. And that's positions. Then you go back to the thumb, and you'll see a bone right underneath the thumb here. Okay? So some lovers try positions that they cannot handle. Okay? So the bone that articulates directly below the thumb, that's your trapezium. And then the next one over is your trapezoid. Then the one that articulates here with your middle metacarpal, that is your capitate. If you're going to break a bone in the wrist, it's usually either the capitate or the scaphoid. And then we have the hamate here. And the hamate bone makes a little handle here on the palm side. Those are your carpals. Then you have 5 metacarpals, and then you have 14 phalanges. And I don't have you learn all the different phalange names. They're just phalanges. You got a distal one, and we got a middle one, you got a proximal one, if you want to be picky. All right, then the pelvis. You probably learned the pelvic bones as the os coxae. You have to know the individual pelvic bones. It's easier for me to show you on the skeleton. Should have brought the 2 pelvises down. If we look here, There's a chunk of cartilage here. This is called the pubic symphysis. So the pubic bone is right next to it here. There's a big hole here called the obturator foramen. This bone here wraps around and you sit on it. If you put your hand up and push in the back, you can kind of feel this part here. This is all ischium. And then the biggest bone here is the ilium. So you have various structures. You have an indentation here. It's in all the bones. That's called the acetabulum. It's right here. That's where the head of the femur fits in. It's held there by a round ligament. You need to know the pubic symphysis again, that chunk of cartilage here, the obturator foramen. Make sure you don't forget any of these. Ischial tuberosity is this rounded part here. It's kind of rough. This is the iliac crest, top of the ilium, top of the hip bone. And this is called the sacroiliac joint. That is where the ilium articulates with the sacrum. This has a little movement too. If it didn't, women would have problems when they're pregnant. This can create some pain too in here. So that should be it for the pelvis. And now the femur bone. Femur is your largest, strongest bone of the body. Makes a nice club. You can see that the head of the femur is at an angle, so it fits into the acetabulum quite nicely and is a ball and socket joint. When people say they fell and broke their hip, it's usually they broke this. It's not the hip bones themselves, usually. All right, so if we look at the femur, you need to know, we can disregard the cervical and anatomical neck. I should redo these. There is a rough area here where you've got the gluteal tuberosity, the gluteal muscles. You need to know the greater trochanter here and the lesser trochanter right here. Attachment again of muscles. And then at the base of the femur, you have pretty pronounced condyles. So you have to know the medial versus the lateral condyle. And the way you do that is think about the femur bone, how its head is angling in. So this has to be the right bone. And so this has to be the lateral condyle. This is the medial condyle, lateral epicondyle, medial epicondyle. And then those condyles will articulate and fit in and rest on your tibia. Okay? All right. Your patella is your kneecap, which I don't have out here. It's a sesamoid bone. It's formed when you start crawling around. That tendon, the patellar tendon, feels there's pressure, so it forms a bone for a little added protection of your knee, which is a good thing. All right, so the tibia, the top is flattened, so that femur can rest on there really well. There's what we call a tibial tuberosity here. You see this little bump here? So you have the quadriceps muscles, they come down, the quadriceps tendon, and then the patellar tendon here will attach right at this little tibial tuberosity. The big thing with the tibia, is that you have a little protrusion here. You can feel this on the inside of your ankle. This is the medial malleolus, because the fibula has, if I can get it to work here, has a little protrusion here called the lateral malleolus that you can feel in your ankle, that little protrusion. And you can see how they form a little arch-like structure here so that your foot, your talus, can fit right up in there and then move. And also it protects the whole ankle joint. Your fibula doesn't have many parts. You have, again, this lateral malleolus. It's really the only distinguishing part. This is a non-weight-bearing bone. Your foot bones, you have to know your tarsal bones. You have the large, substantial calcaneus here, your heel bone. That takes a lot of impact when you walk. Here's your talus that articulates with the tibia. In front of the talus here, this is your navicular bone, and then you have your three little cuneiform bones. I almost said cuboid. These are your cuneiforms. You have your medial cuneiform, your intermediate cuneiform, and your lateral cuneiform. The calcaneus here articulates with this bone right here, and that is your cuboid bone. Then we have 5 metatarsals. And then, of course, we have the phalanges, 2 in the great toe and 3 in all the other toes. So that tibia, again, is going to sit right on that talus. There's that medial, your toe is medial. It's going to rest right there. And then your fibula will come around and wrap here. Calcaneus, of course, attached to your calcaneal tendon. And that should be it. That's it for the skeleton.